Role of Bacillus coagulans, Hendrixia coagulans, BCP92 in managing irritable bowel syndrome. A summary. My topic and why it's important. My topic is a clinical trial that attempts to improve IBS severity via investigating the effectiveness and safety of Bacillus coagulans, BCP92, a probiotic. Several studies have suggested that probiotics are an effective treatment for IBS. This is very important because it shows the potential rise of an effective treatment for IBS, succeeding where other treatments have failed and showing a better future for those with IBS. Definitions of major terms. IBS, or irritable bowel syndrome, is a common chronic gastrointestinal disorder that triggers abdominal pain and altered bowels. It has a significant impact on the quality of life. Bacillus coagulans BCP92 is the probiotic used in this trial. A probiotic is live microorganisms that provide benefits to the host when consumed in adequate amounts. Hypothesis. The hypothesis of this clinical trial is that Bacillus coagulans will reduce the severity of symptoms in patients who have IBS. How this experiment was set up. 100 people were randomly selected to participate in this study. Of those 100 people, 50 were given the test drug, while the other 50 were given a placebo. Both groups were instructed to take the medication orally once a day with a cup of water on an empty stomach, either 1 hour before a meal or 2 hours after eating. The criteria for inclusion consisted of patient age, physical and mental well-being, and IBS diagnosis via the Rome-4 criteria. However, patients with cardiovascular and hepatic disorders, GI disorders other than IBS, and pregnancy were excluded as their conditions could interfere with the results. How it was tested. The patients were given their respective medications and instructed to take them orally for 84 days. IBS severity, gastrointestinal symptom frequency, digestive symptom frequency, stool consistency, interleukin-6 levels, stress relief, and anxiety levels were evaluated over the 84-day span. Figure 3. Figure 3 shows that the severity of IBS symptoms in patients who were given the experimental drug greatly decreased from visit 2 to the end of timeline visit, also visit 5. The placebo is shown in the black and white stripes, and as we can see that these levels remain relatively the same. However, in the IP bars, we see that they drastically decrease over time, suggesting effectiveness. Major findings. No adverse reactions to the probiotics were found, meaning that this drug is safe. B coagulans BCP92 provide a drastic decrease in the severity of IBS symptoms in the patients who received it, while those who were not given the probiotics had their symptoms remain the same. B coagulans BCP92 is one of the most promising therapeutic options for IBS because it drastically alleviates the symptoms, resulting in improved stool consistency. The treatment also resulted in better mental health in the patients who received this probiotic. Do I agree with the conclusions made? I agree with the conclusions made based on the evidence as we saw back in Figure 3. Limitations. One of the limitations of this experiment was sample size. Another limitation is that those with other conditions that could affect the results were excluded, so it is unknown how the probiotic would affect these individuals. How this finding helps us? The finding in this clinical trial helps us to find a method of treatment and symptom management for IBS that is far more effective than previous treatments.